the Awaken Your Ego podcast with Joanne and Ariana. We are a health podcast that explores topics to do with biohacking and self-discovery.
We are also on the self-discovery journey, and we want to attract listeners that are doing the same in order to help them realize they're not alone.
Ego differs from conventional medical spas and wellness centers. We believe that the secret to maximizing one's sense of self is in addressing the entire person, inside and out. We provide state-of-the-art aesthetic treatments as well as lifestyle management and holistic health solutions. We aim to please with our efficient and friendly customer service and guarantee with our scientifically proven alternative therapies and lifestyle optimizations that every patient will leave our care with a boosted ego. Our goal is to help our patients realize the necessity of self-care and to encourage them to prioritize their health and wellness goals. When we make self-care and confidence a priority, then we're able to bring to light our potential for happiness and growth. This podcast is a way to expand our reach so that we are able to spread the word on the importance of self, the whole self, inside and out.
This podcast is for educational purposes only. Please reach out to your medical provider if you have questions about any of the treatments we discuss to see if it's a right fit for you. Now on to our show.
Hey everyone, thank you for joining us again on Awaken Your Ego podcast. Today we're super excited to have Barb Hopkins with us.
Hello, Barb.
Hi.
Welcome.
Excited to be here.
Thanks for taking time. So I just wanted to, get this started with maybe a couple little rapid fire questions. And it's something we do. You just want to answer as quick as possible. You have about a minute. Okay. Just the first answer that kind of comes to your head. No pressure. It's just for fun.
Just to break the ice and get you feeling comfortable. Okay.
Let me start the timer. Hold on. And go.
Okay. Text or talking?
Text.
Favorite day of the week?
Saturday.
Favorite city in the United States besides the one you live in?
Ooh, San Francisco.
Nickname your parents used to call you?
Barbie.
The last song you listened to?
Can't remember. I read a lot.
Oh, good.
Yeah.
Good. Would you rather be able to speak every language in the world or be able to talk to animals?
Animals, all the way.
Favorite holiday?
Christmas.
How long does it take for you to get ready?
Okay, this is sad, but anywhere between 30 to 45 minutes. I don't spend a lot of time on myself.
That's good. On a scale of 1 to 10, how good of a driver are you?
Oh, 10.
Okay. Fill in the blank. Taylor Swift is?
Beautiful.
Okay, you know who she is. Good. At what age do you want to retire?
Maybe by the time I'm 70. I'm hoping I'll be ready to retire by then.
Invisibility or super strength?
Super strength.
Oh, time's up.
All right. That was good. Good answers.
Like there should have been flying in there. I would have picked flying every day.
I know, right? So give us a little bit of more background about you. How did you get started in medicine?
Okay, so that takes me back to my childhood. My dad used to be an ER nurse.
Okay.
And he used to always come home from work and tell me about all these crazy things he saw in the ER. And I was really, geared towards that because I liked hearing all the stories about the gunshot wounds and the procedures they did. Kind of the sick things like the abscesses he would have to drain.
Fun.
And I was just like, oh, I want to do that. So that has always been in the back of my mind. And of course, helping people. Mm-hmm. But probably I'm just an adrenaline junkie, I think. So that's what took me into medicine for ER. I knew I was always going to be in the ER.
Okay. And so how long were you in the ER before you kind of geared towards being a joint injector?
So I've been in emergency medicine for 27 years.
Wow.
And I've been doing joint injections, a large part of that in the ER because I do offer that in the ER as well. But doing stem cell and regenerative medicine, that's probably been for the last 5 years. So that's kind of a takeoff of emergency medicine, right? Because we learn to inject joints when we're working in the ER. We'll provide that service for us providers that know how to do that. We will do that for our patients. And then that just kind of led me into the regenerative medicine. I wanted to do more than just steroids. I wanted to actually do more of a curative medicine.
Yeah. How would you explain regenerative medicine to someone who doesn't know what that is?
So most people are really familiar with doing steroid injections for a lot of purposes, like into their knees or their shoulders or like steroids for their backs and things like that. Regenerative medicine is more of a curative type medicine. So when we do steroids, we're putting a Band-Aid on the problem. We're not curing it, we're not fixing it, we're Band-Aiding it. Just like if I give you a Norco for your pain, I'm not fixing your pain, I'm giving you a Band-Aid for that pain because that pain's going to come back. Well, with regenerative medicine, it's a cure. We are healing it, we are fixing the issue. That's the difference between those types of medicines.
So who would you say would be a candidate for regenerative medicine? Is it for everyone, or is it more specific to patients?
So, I mean, I have seen patients that have been 18 years old and they've had like an injury on like the field. They've been football players, they've been baseball players, they've torn ligaments, labrum tears, older patients with osteoarthritis in their back, in their joints. These are all candidates for stem cell therapy. So if you have an 18-year-old that comes in and they've got some type of small tear in their meniscus and it's taken them off the field for a few weeks and they're trying to recoup back that injury, we'll plant some stem cell in there, some PRP, and then get them back on the field fairly quickly without having to go through surgery. And we don't really want to start cutting on these young athletes, right? We want to do what we can, help their own body fix themselves, and then add a little stem cell to that too.
So let's go back to what a stem cell is, right? Can you briefly like give a simple layman's term version of like what a stem cell is and then how that affects your body to heal?
Okay, so there are various kinds of stem cells, right? In a layman's term, for what we're using for our purposes, we have our own stem cell in our blood, and we find that in our platelet-rich plasma, which is basically we draw blood from you. That is your red blood cells. We put it in a centrifuge, we spin it down, and basically we're taking that red blood cell and we're dehydrating it, and we're taking all the platelets and the growth factors that are in that red blood cell. What you get is a gold color. That's your platelet with growth factors, and that is platelet-rich plasma. That is your own stem cell. What we have to remember about our own stem cell is it's as old as you are. So if you're a 50-year-old coming in and you want PRP into your joint, that stem cell, your own stem cell, is 50 years old. So you're going to get some benefit from it, right? It's not going to hurt you. It's going to benefit you. But that versus the stem cell that we use that we buy from, affiliated labs, that's coming from umbilical cord. It's not embryonic. We're not using babies. We're taking umbilical cord that the mother has donated. These mothers have gone through various blood testing. It's processed. Once they take that stem cell from the umbilical cord, the mother is again tested, and so is the infant, just to make sure that, yes, they don't have Zika virus. Yes, believe it or not, we test for Zika. Hepatitis A, B, C, HIV, every bloodborne pathogen, because we want to make sure that the product we are giving is safe. That is umbilical stem cell. We will mix that with the PRP and then plant that into the injured areas. Some people just want to do PRP. Maybe they're 18, 19, 20. They want to start with that. That's great if it works good for them, and it works also good for a diagnostic tool as well. If you do really good with your own PRP and you have a serious injury, well, we know you're going to do great doing something like umbilical cord stem cell. At that point, we'll mix the two together and then we'll implant that.
I love that. And that whole concept is to help the tissues heal themselves, right? To regenerate the tears, the injuries.
Yeah, if you have a small labrum tear, meniscus tear, ligament tears, strain, injury, we're using it for cosmetics, right? If you're doing like microneedling, we draw your PRP and then we put that back into your face and put it down in there. It's all about regeneration. We want to regenerate that tissue, that collagen. We want to heal ourselves.
One, what are ways, because I know we've discussed different like protocols, but what are ways that we can get our PRP to its best possible potential before we inject the joint, or is that even a thing?
Absolutely. So you always want to have a clean diet. You always want to make sure that you're well hydrated. So everybody, we talk about this all the time. Hydration, hydration, hydration. But you have to think healthy too, right? Healthy eating, healthy lifestyle. All that is really important. We want to calm down the inflammation, which is really good because, we do offer those IV therapies. A lot of people are really on top of it these days, where we do like the Myers cocktail. We calm down the inflammation. So we plant that stem cell into you. We want that stem cell to go to the problem and not all over the body. And a lot of people do deal with all over body inflammation. So when you get that stem cell, you want that stem cell to go to, let's say you're coming in for like a knee joint problem. You have joint pain, joint inflammation, it's osteoarthritis, you want that stem cell to go there. You don't want it going to your abdominal inflammation, right? Or all over, plus my back hurts and my elbow is inflamed too. So what's the best thing to do? Well, let's do a whole body cleanse. Let's get you cleansed. Let's throw in a Myers cocktail, calm down that inflammation the week before your procedure, and then let's do the stem cell. And if you don't have time to do it, well then the week before, let's do at least the IV while you're getting the stem cell done. So, I mean, there's different things that we can do, but you do want to look at it as a whole, because that's an investment that you're making in your body. And if you're going to invest that.
PRP's expensive. I mean, even PRP alone, but also the stem cells. So it's like, if I'm going to put down a couple grand, for a joint injection, I want the best result possible.
You want to help your body, right? So, of course, you're going to want to do all of that.
I like that. I think a lot of people don't realize that there are things you can do, even joint injections aside, but to calm down that inflamed state that our bodies can be put in via diet or lifestyle or injury.
Hey, listen, there's even blood tests that you can do where we actually will do like a food panel on you too, right? We can do a food panel and find out what kind of foods are causing inflammation in your gut. Wouldn't it be great to even know that before you even start your stem cell process?
For sure.
Yeah, because, I mean, it would be a drag. I love avocados. But if they told me, hey, guess what? Avocados causes a lot of inflammation in your gut. Well, guess what? For the next week or two, I'm going to be off the avocados. During that time, I'm getting my stem cell therapy. And those stem cells, we implant those. You get that one shot, sure, but those stem cells are working for you for the next 9 months. So during those 9 months, eat healthy, be healthy, because they are working for you for 9 months. So you really want to stay healthy those 9 months, right? You want the best of the best, and you want that growth for that full 9 months.
How soon does it start taking effect after they get the treatment done?
So every patient's different. I have seen patients, I kid you not, that have sat on my table to get their back done, not being able to sit still during the procedure. It is so hard. And even though we do everything under ultrasound guidance, you have somebody that's bouncing up and down because they're in so much pain. And there's patients like that. I've had a patient like that. And by the time we were done, and I've never seen this before, this is the first time, by the time I was done, he was sitting completely still. And he's like, I cannot believe I am already feeling it.
Wow.
Now, is that psychological? I don't know, but I'm going to believe what my patient says.
Yeah.
I kid you not, 2 days later, he comes back in for his follow-up. He was sitting on the floor, and he jumps up from the floor. And I was like, what the heck? He just bounces up, and he's like, Doc, I feel great. You cannot believe how great I'm feeling. And I'm just like, that's amazing.
Yeah.
That's amazing. For my own journey, I have really bad arthritis in my neck. I've had stem cell put into my neck, and I was having numbness and tinglings from my wrists into my hands. I'd wake up in the middle of the night and my hands felt dead. I had my stem cell done on day 3. Those symptoms were gone.
Wow.
So I know from my own experience,
Yeah.
which is why I love this medicine, because I've seen what it could do for me. So I know what's happening for my patients. When they tell me, oh my God, I feel so much better. I've had a part of that.
Yeah.
And that's what makes me feel good about this medicine, because I know it works.
How rewarding too, to like be that, that tool. So this is funny. My husband and I, we joined this co-ed softball team. I've never done that before, but it's been fun. We've had one game.
One game.
One game. The first game, my husband goes to bat, twists his knee, and he in the past he had a MCL meniscus tear happen, but it was like the exact same place and pain, and so someone like that, and he does construction for a living, so he's very active. It was just it was weird. He's like, seriously, this optional softball, and I'm like hurting myself. This is a joke, but so say someone gets an injury, right? Like very targeted in one place. How quickly should they act and go the joint injection route, or like what would the steps be for him?
Okay, for somebody like
newly
him,
injured,
because, okay, so I do everything under ultrasound guidance. So there are some providers that all they'll do is go into the joint, but
the space of the joint,
just into the articular joint. How I approach it though is, if I know that you have a tear in the meniscus, why would I not target that area? So we will use the needle, and under ultrasound guidance, you will be able to see me actually go into that meniscus, if it's lateral, if it's medial, and we'll plant the stem cell or the PRP in there. And the sooner the better, right? Because this is all about getting his pain to go away as soon as possible. So why make him suffer? So I would have said, why didn't you call me last week and tell me that? Because
Honestly.
we could have been already
Seriously,
doing it,
Ariana.
right?
It happened on Friday, okay? It's only been a few days.
Okay, it's only been a few
No,
days.
but it's funny
but
because
today's already Wednesday.
Yeah, because even I was asking Dr. Rhodes, I was like, okay, do we have to wait till swelling goes down? What are the next steps, like right after injury? And he's like, well, let's get imaging confirmed, then we can do the joint injection route. But just like you're saying, he's like, there's no point in waiting.
Well, I mean, even a knee x-ray is not going to show me anything but the bones, right?
Yeah.
I mean, those are good for if I'm looking for like bone on bone, that sort of thing. If it's a medial, or a lateral type injury when it comes to when you're just looking at the bones. If I'm just looking at the bones and I look at the x-ray and I'm like, oh yeah, their knee joint space, it's really bad at the medial aspect, or maybe they're more bow-legged and so their injuries are more laterally, and you can see that in x-ray. If I have an MRI,
He's doing an MRI.
Get the MRI, then I'll look at it and I'll be able to say, oh yeah, the MRI says this, this, and this. But under ultrasound guidance, we can actually look and see those little tears and things with ultrasound as well.
Oh, cool.
Yeah, so.
No, I like that because I think a lot of people are like, I don't know what to do. I guess I just have to heal on my own.
Yeah.
They just like wait and wait and wait until they're suffering to a point they're like,
no.
ready
Because
to
I mean,
come
even
in.
patients that have, let's say they go in, let's say they had an ACL tear. It would behoove them to come in and have their own PRP put in there and stem cell around that, right? Because it's going to help them recover faster from that injury.
Oh, I love
Yeah,
that.
you're going to recover from an ACL repair if they go in and replace the whole ACL or if they repair the tear. But don't you want a more speedier recovery?
Yeah.
Absolutely, right? It's about getting back to work, getting back to having fun. Why would you not want to
Yeah.
speed that up?
Well, and I love that this tool that we're now going to offer at Ego, the joint injections with the stem cell and the PRP, it's something attainable. It's something that people can make an appointment and do like right now. They don't have to wait for insurance and go through those like loops. It's like they can just access it from you directly, almost on demand. I mean, essentially.
Right.
Yeah.
Or even those patients that, let's say they have, I've had so many female patients. I don't know if you guys have watched over this last 3 years, how many female patients have come in because of COVID. They have lost a lot of hair.
Ooh, yeah.
We have seen
Interesting.
so much hair loss. I have grown so many women's hair back using the PRP treatments just for alopecia in general.
Yeah.
I actually didn't even start doing that. I did my husband's hair first because I wanted to make sure it worked using some exosomes with PRP. He had a little tiny, bald spot, and I was like, well, we better stop that now before that gets any worse. Let's shut it down. And he was my first patient. And as soon as I saw that it worked and I was able to grow that back, I'm like, okay, I'll get behind this. I really want to make sure it works before I start telling patients, oh yeah, it's going to work. It's perfectly fine, until I see it. Once I see it in practice or in theory, then I'm like, I'll be all over that. So that really works too. So for any of those patients that are, going through COVID or have already gone through COVID, they're having a hard time growing their hair back. These are candidates too that we should be talking about. That would be really a benefit for them to use exosomes and PRP too.
Oh, that's fantastic.
You mentioned exosomes. Could you
Yes.
briefly give us an explanation about that?
Okay,
too?
so exosomes is basically the stem cell, right?
Oh, okay.
It is actually the little tiny part of the stem cell that's inside the stem cell. It's almost like the key. It's the one that goes in and triggers that says, hey, let's jumpstart you. Let's get you producing your own stem cell again. That's all it is. It's the key. It's the tinier portion of the stem cell.
Interesting.
So technically, when you talk about stem cell, it's like, well, do we even really need the whole stem cell? You actually only need the exosome that's inside the stem cell. But the company has taken this to different levels. We started with just stem cell. And then after further research, just like medicine, it's always growing, it's always changing, we're always learning more. We found that, the working key of the stem cell is actually the little tiny thing that's inside the stem cell called the exosome. So they just break it down further. Those exosomes are easier to actually get into the scalp because the scalp has a deeper depth where you can't really get in like how we can like in joints. So this is a little bit area that you want those tinier particles to be able to get into, I guess, in layman's terms.
Well, it's funny you mentioned that because I recently, and this is me being very vulnerable because I'm still like weird about it. It's like I have a huge bald spot in the back of my head. Never have I had that in my life. I've never had any kind of balding going on other than with my thyroid being slow. It feels like it's thinning. But a month ago, I went in to get my hair just dyed. And my hairdresser was like, what's going on? Like, this
Yeah, what's
wasn't
happening
here
back
2
here?
weeks ago. Like, why is there like a bald spot? And I think it's stress induced. I think
Probably.
I'm going too hard at work, but it makes me want to, I'm going to set things up with you and maybe do a couple injections, and I can track my progress and take pictures so we can share that with our clients.
That would actually be a really good idea, because technically, you know, we'll do like a series of 3. So we'll do it once a month for 3 months. Usually by the time you're in that 2nd to 3rd month, you'll start seeing that new baby hair growth. You won't see the full thing for at least 9 months, but just seeing that new baby hair growth at that 3rd month is what's going to keep you like, okay, thank God.
Well, and it's funny.
Working,
It's funny because it's like I realize the hair loss is because of stress, but now that I'm losing hair, I'm way more stressed. So I'm like, this cycle is not a good
It's kind of
cycle.
vicious.
I'm like,
You sure you didn't get COVID anywhere in there between, or?
I mean, that always
were
could be a
asymptomatic,
possibility, but I don't
yeah.
think so. I don't feel like I ever was down, and I was testing like periodically throughout that time period when it was like really going on, but who's to say?
Yeah, who knows?
Yeah.
I mean, people that are listening to this might even be saying, oh my God, is that why I have, because a lot of people don't even know about it.
Yeah.
You know, I feel like we all talk about it.
The
in
long
certain
hauler
arenas,
syndrome.
But if you're not in those arenas and your ear's not to the ground with certain things like that, you're not going to hear about it.
True. And I think the biggest complaints we've heard for like long-term COVID symptoms is like the brain fog, the hair loss.
Yeah.
Taste and smell.
The fatigue.
Taste and smell, still
yes.
fatigue. Like those are the main things I feel like we've seen patients that come in.
Yeah.
Well, yeah, because I'm sure a lot of them come in for IV therapy with the fatigue, because, I mean, that's kind of a constant thing that we've been dealing with COVID too, right?
Yeah.
Everybody is still really tired from all of that.
That's very true.
So what would a first appointment or assessment with you look like for a new patient?
Definitely medical health history. Let's find out what's going on with you. Not just what the problem is, but all other comorbidities. Like, do you have hypertension? Do you have diabetes? Because these are things that we have to take in consideration whenever we're game planning for you. Then physical exam. And then we'll talk protocol, you know, decide what program's best for you. Are you looking for PRP, just PRP? What's your age? How that's going to play a factor in it? And what's your outcome? Like, what are you looking for? This isn't something like, be like, oh, you're going to be 100% cured. The game plan is to get you back to living a more normal life, getting you back to doing things that you want to be able to do. You want to be able to go walking again. You know, so many people live in so much pain that they find that all they can do is get to work, and then on their days off, they are literally staying in bed or on the couch surfing because they are recouping from their work week, only to get up and go back to work the following week.
Yeah.
We want them to be able to enjoy those weekends or that long stretch of time when they do have like 3 days off, to be able to go, you know, if they want to go to farmers market, if they want to go to a car show, if they want to go to San Francisco or Santa Cruz, or if they want to go hiking,
Yeah.
you know,
get that
Or
quality
if they want to
life
get on the
back.
floor with their grandkids or
and
whatever.
right,
Yeah.
I mean,
Or play softball.
play softball without killing
Hopefully
themselves.
not get injured.
Yeah, and if they do, then, you know, we can fix that.
Yeah.
You know, but be able to live life again.
Yeah. Get the quality of life back.
One-
Yeah, I mean, because realistically, how we are today, we are working harder, we are playing harder, and our
Recovering
bodies
less.
we're paying for it. We're paying for it, but we want it. We want more. That's just how we are. People are like that, and there's nothing wrong with that. But we have to take care of ourselves too.
On
So,
average, how many times would a patient see you for treatment and then maintenance afterwards?
so if it's stem cell therapy, usually it's kind of a one and done, right? You come in, we'll do consultation. Then whenever you're ready to pull the trigger, we do the treatment. You'll see me again. We'll do the treatment. We'll do probably a follow-up after that. Make sure you're doing okay. And bye-bye. Have a good life.
to go.
Now, it depends on how damaged you are too. Like I said, I've had my neck done. It lasted me for about 3 to 4 years. I had a really bad fall. I had to have my stem cell done again. So you have to think about re-injuring yourself if you re-injure yourself, and what you're looking for too. Are you, you know, I'm in my 50s, so I don't want to have neck surgery. So if I have to get my stem cell done, you know, every 5 to 10 years, I'm going to do that before I'm going to have surgery.
One, what makes someone not a candidate? Like, what would disqualify?
Okay, so the only person that was going to be absolutely not a candidate is anybody who's being treated actively for cancer. So if you're going through chemotherapy, and that's just because we already talked about having a healthy lifestyle. We want you coming in healthy, best that you can be at that time, because you're investing a lot of money in this product, right? So you are not at your best when you're going through chemotherapy. And that doesn't have anything to do with, oh my God, it's stem cell and that creates cancer. It's not about that. It's about, we need you to be at your top. So even if you have diabetes, doesn't mean you can't have stem cell, but if your hemoglobin A1C is at a 13 or a 14, I would ask you to please try to get that under control. Let's try to get you down to more manageable, like an 8.0 at least, before we start putting stem cell in, because 13, 14, 12s in your hemoglobin A1C, that's obviously you're not living a healthy lifestyle.
Yeah.
And if you have more comorbidities with hypertension, high cholesterol, that means you're on more medications. Your stem cell might not be as effective for you than it would be for somebody like me who doesn't have hypertension or diabetes or high cholesterol. My stem cell is going to work a little bit better for me.
What about pregnant women?
We would ask that you probably wait until, because even with that, especially if it's like a knee, you're already carrying extra weight. You really don't want to, you kind of want to wait to be back to your, almost close to your regular weight, right? Your joints are only made to carry so much weight, regardless if you're heavy from pregnancy or because of obesity. That's another thing. We talk about that whenever we do seminar or whenever we do that consultation. It is not going to fix everything. If you're overweight, this is what happens to patients when they have knee injuries, shoulder pain. These patients can't exercise. They would love to get out there and exercise, but because they are having pain, who wants to get out there and walk or pump iron when their shoulders are hurting? That's very difficult, right? So we have to come up with other alternatives. So if we can get their pain managed with stem cell, their weight will start coming off, because as they are feeling better, they can start walking more than half a block. They will start walking 1 mile to 2 miles as they feel better. And like I said, those stem cells, they will work for you for a full 9 months to 12 months. They will continue to build and work and heal.
I know with knee sorry, do you have
go ahead.
Okay. I know with knee injections, we do offer another option as well. And I know you're very well trained on like the Halogen injections.
Yes.
What does Halogen do to benefit the knee, and how quickly?
Just using Halogen or mixing it with PRP? So
mixing with PRP for sure.
Okay, yes. So
but just
Halogen,
introducing, what is Halogen?
Yeah, so Halogen, hyaluronic acid type of product, right? So we go in, we're trying to lubricate the joint. When you mix that with PRP, you're actually mixing your own stem cell with that. So we're trying to cure the problem that's within that joint. So a lot of these patients have arthritis in that joint. So you can feel your knee if you move it around, or you can hear it kind of crunch, crunch, crunch. That's arthritis, people. When you hear that crunching, that's called crepitus, and that is arthritis. So your PRP can start diminishing that. A regular HA product, like Halogen, it's not going to make the arthritis go away, but it will lubricate that joint, but it's not going to cure the problem.
For sure.
But you will have a little relief from it, right? Because we're lubricating it. You just go and throw PRP in there, and then you just kind of made it like a perfect little product, right? Because now we just threw your own little stem cell in there, and now we're just not lubricating it. We're kind of curing a little bit of the problem too.
It's what I've seen with some of the patients that have had that done. It's almost like it's encouraging, like the Halogen, that lubrication that happens. Like, okay, wow, my joints feel better. It's easier to move around.
Hey, you get it, you walk out saying, okay, that actually didn't feel too bad, and yeah, that joint actually feels looser. Well, it should. I mean, we just put product in there, right?
Yeah.
You're going to feel the same way after PRP. If you come in, you have osteoarthritis in there and it doesn't feel too great, and then we go and lubricate it with PRP, you're going to be like, wow, that feels so much better. I like it. It's working. It hasn't even started yet.
Well, and I love how you're like, it takes 9 months for it to fully take effect, right? But it's like, it almost like it gives you that encouragement to keep waiting for that full, regeneration.
So you think you feel great that first week. Think how much you're going to feel at 12 months.
Yeah.
No, definitely.
What would you say is the most common injury that you treat or site that people come in and complain about?
Wow. So I would say it was probably knee. But, I see a lot of shoulders now and a lot of hip. And I do a lot of ankle too. I mean, before it was just mostly knee, but as word has gotten out, the more we do with PRP and stem cell, people start talking, everybody's chattering about it. And back in the day, it used to be just for those athletes. You see a football player now get injured on the field and they're taking off and they're going to the locker room. What do you think is happening in that locker room?
Yeah.
You think they're just getting ice and cryotherapy?
Yeah.
No. They have somebody back there like me. They are drawing their blood and they are getting PRP and stem cell. Yeah.
That must be nice. Like, treat
Where's
it
my
now.
on-call stem cell guy?
Well, that's why they get paid the $1 million, right?
Yeah.
But now, I mean, people like you and me, now we can have that. It's not just for those athletes anymore.
Well, and I've heard so many clients at the wellness center that like they literally take an annual trip to Mexico. They get their stem cells from who knows where, and then they come back and they do this whole back
That
and
just
forth.
scares me.
So scary.
I mean, and I've heard good things about it, I did great. But for me as a provider, that scares me. I've had a patient come and say, she had the stem cell and she wanted me to give her the shot. As long as she brought it to me, would I inject it for her? I don't know what kind of stem cell it is.
Yeah.
I don't know where it came from. Sorry, no.
No.
Our stuff is from the United States. It's grown in the lab that's been FDA approved. Now, the stem cell itself is not FDA approved, but that lab has gone through all the requirements it needs to go through. And you just have to remember, FDA approved stem cell, that's probably not going to happen for a few years, if ever. There's just not a lot of money in it for the pharmaceutical companies. There's not a lot of money in it for orthopedic surgeons. There's not a lot of money in it for the hospitals because they're going to be missing admissions, surgeries, narcotics.
Yeah.
The people that are making the money are the people that we're buying our stem cell from. We have to pay for it. And then, of course, us is we're providing it to our community.
What or how long is the downtime after a treatment?
Okay, so normally with most patients, I tell them try to have the next day off.
Okay.
Now, every patient is different. I did my stem cell on my lunch hour, and then I saw another 8 patients.
Wow.
But you're a stud. You're
That's
also
me.
you're
That's
also
me.
an ER doc that jumps out of helicopters.
That's me though, right? So I would not pretend to tell everybody, go get your knee done and go work a 12-hour shift in the ER, because that would not be good. I would prefer you to get your stem cell done or your PRP done, take the day off the next day, especially if you're an aggressive worker, if you're working constructions, you're going up and down ladders, if you're driving a truck and you're up and down that semi truck. You got to be a little bit more careful with those patients, right? Because they're going to be sore, because we are going into those specific areas of the knee, and sometimes that could be 6 to 7 different injections, right? If I'm just going into the knee joint, super easy, 1 injection. But most times those patients have meniscus tears, or there'll be tears in, the ACL, and we want to hit the Hoffa pad. So we're hitting Hoffa pad, plus the joint, plus the medial meniscus and the lateral meniscus and the MCL and the LCL. That's just the knee. When we're doing the shoulder, we're going to hit the AC joint. We're going to hit the glenohumeral joint. We're going to hit the bicep tendon. We're going to hit the infraspinatus, the supraspinatus. Whatever the MRI shows me, those are the areas we're going to hit. So it's going to be a little sore. So take a good 24 hours to babysit yourself and stay home, and don't be doing a whole lot. Don't be lifting your toddler and,
I was going to say, because that's hard for most of us to
It is,
say,
but
I need to relax.
You can do 24 hours to
after
kind of
this.
relax a little, yeah.
Yep.
And it's not like you can go back to taking NSAIDs, right? You can't take NSAIDs 5 days before the procedure and 5 days after. You can take Tylenol, but NSAIDs and blood thinners, we have to have a conversation about that too. We don't want bleeding in the joint before and after, so.
What do you think that sets you apart as a medical provider and someone who does these types of injections?
I don't know if there's anything that really sets me apart. I think most providers get into this type of field because they want people to feel better, right? We want our patients to do well. And that's even if, that's for orthopedic surgeons too. Because listen, stem cell is not the answer for everybody. This is your last stop before surgery. If you have to get a knee replacement, I've had that. I've had a knee replacement surgery. I had a great surgeon, God bless him. I was a lucky girl. But I would have liked that opportunity before I had that knee replacement surgery to have stem cell. But that wasn't offered to me, and it was pretty much told to me, it's not going to work for you, don't waste your time, and you can't afford it anyway. Well, guess what? I could have afforded that. And the time I lost in work alone, because I had both of my knees done 7 days apart.
Oh gosh.
I was off work for 6 months. I could have paid for my stem cell 20 times over.
For sure.
You know, I feel like that opportunity was taken away from me, because now I see patients with knees worse off than mine, and they've done great with stem cell. So for me, that's a missed opportunity. That's my takeaway. If I can save you from getting a knee replacement, I'm going to do that. But at the end of the day, if you still have to get that knee replacement, I can feel good about it, and then you can feel good about it, saying, you know what, I did every single thing I could possibly do, and nothing worked. Go have the knee replacement. But at least you'll feel good about it.
Yeah.
I will never feel good about my knee replacements. Even though I did good. I'm not saying my surgeon was bad. He's one of the best surgeons ever, and I love him to death. But I'm lucky. But I have to be careful the rest of my life. I can't snow ski again, you know? I could, but I'm afraid to. There's just certain things in life I can't do anymore. I don't want that for my patients. So if we can do stem cell, we can fix that, or get them a few more years of having a better lifestyle without having surgery, that's what I'm about.
When you believe in it, you feel it. You can feel your passion for it. You like,
because I've seen it
you've
work,
seen it,
and it's worked for me.
Yeah.
So that's the end goal, right?
Yeah.
That's the end goal.
Well, I've heard that you are a badass injector, so clearly you have the skill to do that.
I've been doing it a while
You're
now.
being very
Yeah.
modest about it, but yeah, I feel like it's the passion that you are totally in this, you believe it, and you care about your patients. You
Yes,
care about
absolutely.
their outcome. Yeah,
Yeah.
so that definitely sets you apart and something to be proud
Well,
of.
thank you. Yeah, if my patients aren't happy, I'm not going to be happy, right? So we want to do right by our patients.
Yeah. So I was going to ask you, what is the most fulfilling thing about the services that you offer? But you kind of answered it, but just to give you more of that.
Yeah, getting that patient satisfaction, making them feel better. That's the best thing. Going to work and knowing that, hey, I made that patient feel good. My husband always says, how does he say it? Oh, honey, there's another one of your miracles.
Oh,
you know, when
so
my
cute.
patients come, he'll come in, sometimes he'll be in my office and bring me lunch or whatever, and my patients might say, oh my God, you've changed my life, and I feel so much better now, and thank you so much. And my he'll always remind me, he's like, honey, there's goes another one of your miracles. You know, and I'm like, that technically it's not my miracle, but that's the miracle of stem cell,
Yeah.
right? That's the miracle of stem cell and PRP, our own miracle that we have in our veins.
Yeah.
That we
And
could
you're
be
just
using
that
for
vessel
ourselves.
helping them.
Yeah, how awesome
receive
is that?
Yeah.
Yeah.
No, that's the best feeling.
So do you have any goals that you're currently working on or any projects?
Well, getting the stem cell and PRP program started there at Wellness and Ego. That's our big project right now. And then I started my doctorate a couple of years ago before COVID, or during the midst of COVID. So I'll probably get back to that.
Nice.
And then use our research as we're moving forward here.
Yeah.
Doing the research off of this to kind of work through my clinical on that. So
that's
those are the two
awesome.
things I'm working on.
Just
Yeah.
little things,
Yeah.
just tiny,
Little
just my
tiny
doctorate.
things. Yeah.
So I was going to ask, what do you like to do in your spare time?
Anything spent with my family. So spending time with my grandkids.
Tell us a little bit about your
kids.
family.
What do you want to know? Let's
How many
see.
kids do you have?
I'm
I know you said you were married
for
27
almost 30
years.
years. Yeah, I have 4 grown children. I have 5 grandkids now.
Nice.
Labradors, 2 Labradors, and we like to garden. I'm an avid reader. I like to read. I'd rather read than watch television.
That's
and swim during the summertime. We're constantly out by the pool barbecuing, and that's pretty much it. Traveling, we love to travel when I have time. Just trying to find that time when I retire.
Yeah.
When I
Or
retire.
make
I'll
the
probably be too old by
time.
then, but yeah. That's another thing. You know, once you retire, you know, I love my job so much, it's almost like I don't think I can retire at 65. I think I will be bored. So
You seem like a very, driven person. You
Yeah.
keep yourself busy, even with your hobbies and like the research. You're like a life learner, like you're a student. And so I totally
that's
get that.
kind of
You
hard
like to
too.
be
Yeah, 'cause I always
stimulated.
like to be doing something.
Yeah. No, I feel that. I feel like that's me too. I like to keep myself scheduled tight, so I
know,
always have
Ariana,
something to do.
What's our next project? What are we going to do when this is almost, to fruition?
Yeah.
We have to come up with something else.
Oh, there's always
I'm sure
there's
she'll come up
always
with
something
something.
else.
Yeah.
We'll figure it out.
All right. Well, thank you, Barb, for joining our podcast.
Thanks for having me. It's been fun.
So if someone was wanting to schedule a consultation with you, how would they be able to find you?
You will find me. I don't know. That's a good question, but I guess you're gonna call the offices there. Are we going by wellness?
Ego
So
video.
wellness-
Ego.
Ego.
Yeah.
Okay.
Call the offices of Ego.
Okay. So online.
Modesto, California. Yeah.
All right.
Get on
Thank
the
you
schedule.
again for coming. Listeners, we hope that you enjoyed this, and we'll see you on our next episode.
I'll see you in the office.
Yep.
Thank you for listening to Awaken Your Ego, a podcast that explores biohacking and self-discovery. We hope you follow us on Instagram and Facebook to stay up to date on what we're working on in your area.